Well, now things are certainly starting to maybe get back to some sort of normality as we hear that dental practices can start to reopen. Mark is joining us from the Isle of Man Association here. Mark, I know it's not exactly going to be like it was, and certainly not everyone even wants to yet open. So you can take us through what it says, and we also do have a statement I know that's been issued, so while we're talking we can run that in full. But can you give us the highlights? What exactly, and there's so many people needing to know this, what exactly can we get on the Isle of Man now in the sense of dentistry?
Well, thank you. At the moment, we've had an announcement by Tynwald that the practices can open. What we've been careful, and we're pointing out to sort of patients and basically the island population, is they've done such a brilliant job of staying at home and controlling this virus to get us on the right place of the epidemiology curve, that we obviously want to sort of keep that low. We want to keep that, as close to zero as we possibly can. So the practices themselves aren't open yet. That's the message that we've got. The Isle of Man Dental Association have been working very closely with the Department of Health to sort of to open the practices in a safe way, but in a safe, manageable and risk-assessed way. And at the moment, we're still going through various procedures to do that, so that we realise that as healthcare professionals, there's always some risk in everything we do, and we can't get rid of that risk completely. Everyone's talking about the new normal and the new way of going through things and what the world's going to be like. So we're trying to sort of manage that risk the best way that we can, so that it's safe for patients, it's safe for our staff, and it's safe for the dentists themselves. But we realise that the practice owners have to open up in a way that allows us to provide treatment for our patients, not just see a patient and then give them advice. So the reason we're sort of holding off at the moment is so that we can sort of talk with the Department of Health and Social Care and get a way that works for everybody. And that's kind of what's happening. In the statement, it says anyone with a dental emergency, and I can go through the emergencies if you need to, but anyone with a dental emergency needs to phone the number that's on the website. I'll read that. I've written it down so I get it exactly right, but it's been there for months. It's the 642-785, and you need to ring that number, not turn up to one of the sort of two dental centres that we have open. But that's your first line of help, if you like.
I mean, it's
you can also email the practice.
Sorry, I was going to say it's always been difficult sometimes to get to see a dentist in normal times. I mean, this is going to put everyone back. I mean, some people saying it's 20 years ago, before everyone gets their teeth sorted out. I mean, wouldn't you have to be in full respirator gear and all that sort of thing technically to be 100% safe?
To be 100% safe is impossible. The doctors and nurses working in COVID wards will tell you that even with all that gear on, they're still not 100% safe. So there's always some risk in everything we do. And again, it's managing that risk. What we would hope the press don't do is sensationalize things. People have been told stay at home, and that's the great advice. That's still the advice. Be sensible. What we're sort of saying is that there's a certain degree of risk treating anybody, but we believe that risk can be managed. And there's always been risk before, let's say before February, before COVID. There was the risk of, sorry, my phone's just pinging up in the background there. There's always been a risk of tuberculosis, HIV, hepatitis. So again, we've always had to manage those risks. I mean, for the association, and we've been working quite closely with members of the Republic of Ireland Dental Association, because the Republic of Ireland's in a very similar place on the sort of the RO curve that we are. I think if anything, the Isle of Man is in the terrific position of being ahead of them. So the difficulty for us is, we have to look at what other people are doing and try and see what risk assessments they've taken, see what protocols they've got in place. Now that's not easy for any of us to do, because that's pages and pages and pages and pages of protocols. there's fact out there, there's fiction out there, there's sensationalism out there. So we have to look at what is fact and what is fiction. But also with the protective gear, I was speaking to the chief executive officer of the Irish Dental Association. They've got over 2,000 dentists, and he told me yesterday that there's a worldwide shortage of protective gear. We can get protective gear, but as you've just said there, is it the correct protective gear? To be safe, if you could be as safe as possible, you'd be practicing in a kind of spacesuit. But you can't treat patients, you can't treat dental patients wearing spacesuits. That's the problem, and it's kind of looking at, right, which protocol works. How can we get patients in safely, efficiently, and treat them effectively? But also, you've got to remember that as dentists, people don't like going to the dentist anyway, so we have to be able to sort of treat them in such a way that they're not experiencing pain, they're not experiencing discomfort, but again, treat them safely.
Now, no one has to open. This is important, isn't it? This is advice you're getting anyway from the government, so the dentists themselves can do their own risk assessment and decide when they're ready.
Yes, absolutely. Nobody is being forced to open. But as healthcare professionals, dentists want to help. We want to help our patients. We want to help people in pain, because I don't know whether you've ever experienced it. There is nothing worse than dental pain.
Trust me, I have a phobia of dentists because in the past things have gone a bit wrong, maybe years. I'm talking about a long time, and it stays with you though, doesn't it? It stays with you.
Yep.
It makes you very nervous.
Absolutely. No. And that's the worst thing. And then the problem with dental problems are the longer you leave them, the worse they get. They don't get better. You need some treatment. So it's frustrating for the dentists that we can't jump in and help people. We're having to say to people, look, this is the advice, follow the advice. But again, we're working as closely as we can and as quickly as we can to open up, but open up in a safe way, and open up in a way that allows us to help people sort of quickly.
Yeah, it's interesting to say that about people putting off things, because we hear that with A&E, suddenly the numbers drop down massively. People rather just put up with whatever they had. I'm sure the same things happen with dentistry, really, isn't it? People just sitting on problems massively, probably.
Yeah, absolutely. There's simple advice: brush twice a day, take care of what you're doing with your mouth. Everyone's been locked down, everyone's been at home, so the worrying thing for dentists, have the parents just been grazing on sweets, snacking all day? The sugar intake will have shot up, and that's the worrying thing for us, that when we do start, if we can't see patients, I would say quickly, we're not going to be able to see the volume of patients that we saw before, at least for the near future or the foreseeable future, because again, everybody has to be vigilant, everybody has to be careful with their general health. There's no stigma with this. This is not something people have to be embarrassed about. This is not something that people need to sort of just go, right, I've got symptoms, I've got a dry cough, I've got a sore throat, I'll keep it quiet. If people have dental appointments and they think that they've got symptoms, tell the dentist straight away. That way we can manage them and direct them in the right place. Again, it's all about trying to keep patients, staff, and dentists safe in the long run. It's building the rapport and the understanding between the patient and the dentist back up again. That's going to be quite a hard thing, because that's hard to do normally when you're seeing patients. The fact that none of us have seen patients now for 2 months, it's going to be a nightmare to sort of get that rapport and get their understanding back up. But that's what we're asking for. It's an understanding between the patients and the profession. And
just to finish with, you say that the 2 months you haven't been working. Has the government schemes at all helped you guys out, or have you just been sitting at home, doing all that DIY work that you've been putting off?
I've done a lot in the garden. No, we've had help from the government, sort of furloughing the staff, and the dentists. To some extent, we've been keeping up with all our continuing professional development, all of the research side of things we need to do. We've also been looking at what's on how to change the sort of operating ways in our practice. So we've used the time as wisely as we could. And as I say, I think at the moment, that's all the help that sort of I've applied for, just for my staff. Just making sure, that salary support's has been fantastic for them, because again, they don't know what's happening. We don't know when we can open, and of course, so I've got my nurses saying to me, well, I'm at home, I've got the kids, I'm going out of my mind because when can we start seeing patients again? And what you've also got to remember is a dentist and a dental nurse, social isolation for us, I know we're gowned up, but we work sort of a foot away from each other. So for us, that close contact, we are protected, but again, the social distancing for dental staff, isn't there. It can't happen because we're so close to the patient and we're so close to each other. So that's something else we've got to consider, and I think, certainly my staff have missed that close interaction because we do all work together.